Hello, everybody. Welcome to another episode of You're the Cure. I'm Dr. Ben Edwards. We're going to talk measles today. I had previously planned on playing another show that was more about quantum medicine and quantum physics and how your thoughts impact your genes and your DNA and your mitochondria and your intracellular water, and how fear really impacts your physiology negatively. And we can touch on that today, actually, because this measles outbreak that we are currently experiencing here in West Texas and down in Gaines County and other places around the area has kind of drummed up a lot of fear. And we're going to try to squelch that today. But first, just a little bit of background. Whenever there's kind of a hot topic like this come up, we have a lot of new listeners. I even had some media reach out to me this week at the clinic wanting some comments. So I like to just frame this real quick, especially if you're new to the show or a new listener, which we're gaining new listeners all the time. Um, I'm a medical doctor. I'm licensed by the state of Texas. I graduated UT Houston in 2002, conventional minded. Both my granddads are MDs, two uncles are MDs, and a great granddad was MD or great great. And I just want to be a small town country doctor like my granddad. So I'd moved out, my wife and I and our kids, or one kid at the time, we moved to Garza County, the Garza County Health Clinic south of Lubbock in Post, Texas. And so that county clinic was a great place that I called home for 7 years. And we were just doing the normal thing, including following the CDC schedule on fully vaccinating all my kids. I had no reason to question that because in medical school, here's what I learned about childhood immunizations, vaccinations. Basically, it was this: they saved humanity. Therefore, learn the CDC schedule and implement it in your clinic. And literally, that was about all I learned. So I came out of med school. I wrote these things down. Three big assumptions. And in listening to the local media, some local, health reports and interviews with various health officials, talking to the general public, patients that I talk to, other colleagues of mine I talk to, pretty much everybody has these same three assumptions. So here's the big three assumptions I had coming out of medical school. Assumption number one: vaccines were responsible for the 98 to 99% drop in infant mortality in the early 1900s. Around the turn of the century, the late 1800s, early 1900s, you had about a 50-50 chance of making it to your fifth birthday if you were an infant born in especially a big city like New York City. So it was a very high infant mortality rate. And I assumed that 99% drop in infant mortality by the 1950s, 1960 was because of vaccines. That was assumption number one. Assumption number two: that vaccinated children were healthier than unvaccinated children. Assumption number three I had coming out of medical school was that the current CDC childhood vaccine schedule had been fully studied for efficacy and safety. So those are three really big assumptions. And of course, if you assume all three of those are true, then line up, let's do it. And that's why I did line my kids up. So we're going to talk about those three assumptions and bring the truth to the fact that actually all three of those assumptions were wrong. And that's not my opinion. That's well established in the peer-reviewed literature multiple times over. So that's I want to just start with that kind of groundwork. And for new listeners in particular, in 7 years into conventional practice, when I learned that diseases were really consequences, which I know sounds crazy, but the first heart attack in the United States was in 1912. There was only one in the whole country, and the founder of Hopkins Medical School and the founder of Western and modern medicine in America, Sir William Osler, was interviewed about his career, and he saw zero heart attacks in his entire career. And now 600,000 to 700,000 Americans die from heart disease every year. It's the number one killer. I didn't know that. How did we go from non-existent to one heart attack in the entire country about 100 years ago to the number one killer? There's a reason for that. There's a reason all our kids are sick. Over 50% of our kids have a chronic disease now. We have the unhealthiest kids in the whole world. We have the highest infant mortality rate in the whole world. We have the highest maternal mortality rate in the whole world. And our overall mortality rate, we die younger than anybody else. We take the most medicine, spend the most money to get the worst outcomes. I didn't know any of that. My colleagues that I talk to don't know any of that. However, many are waking up. Trust in doctors has dropped from 70% January 2020 to 40% and falling. We have a massive problem on our hands, and moms in particular are waking up, doing the research that again is out there. I didn't learn it in med school, but it's there to be learned. And at this point, I would almost say it's willful ignorance on the part of pediatricians. I know that's a strong word, but I'm kind of going to call out my colleagues. I've actually had some pediatricians call me from around the state looking at how can they get out of their corporate medicine clinic job. One almost had tears in her eyes because she said she has to treat the kids in her practice a certain way, and she goes home to her own two little girls and doesn't treat them the same way, and actually can't treat her clinic kids the way she treats her own kids. I mean, that's where we're at. And then honestly, guys, this is what gets me the most passionate. And I try not to let emotions, you know, get into my influence my thinking too much. But I get texts like these, not infrequently. This was a few weeks ago. Text. This is a random question. Now, this was from a friend. Random question for you guys. I have a friend who has a friend in Amarillo whose 3-year-old granddaughter became nonverbal following her last round of vaccines. This is not a political thing. It's not anything. It's a fight for these kids. That is happening. I mentioned last week over 1 million cases of new diagnosed cases in 2014 of autism. And in that same year, it was just over 600 cases of measles in the whole country. Everyone used to get measles. The body's designed to kill measles. Vitamin A and vitamin C studies have been published showing it improves the outcomes in measles. We don't need to be fearful of measles. We need to be informed. So once I learned more from my conventional medical training, I learned some quote unquote alternative things, such as nutrition, which I only got 2 hours in medical school on that. But I learned that, wow, the body can fix itself and defend itself. So I started giving true informed consent to my patients. If you have acid reflux, I can write you standard of care medication called Nexium, or I can offer you an alternative, fix the problem, resolve your acid reflux. You can manage your asthma or you can resolve your asthma. You can manage your diabetes or you can resolve your diabetes. So I didn't know about this second option. And once you do learn, as a physician, you're morally and ethically obligated to inform your patient. There are options. So we're going to talk about that today: informed consent and options and the truth. So I've asked Barbara Lowe Fisher to come onto the show today. And I recommend everyone go and learn from Barbara and her friends, her colleagues and coworkers, the National Vaccine Information Center. Barbara, this is where I send so many people that call during outbreaks like this, like measles. Where can I go learn the truth? Where can I get more information? Where can I get informed consent, basically? NVIC.org, National Vaccine Information Center. Barbara Lowe Fisher, welcome back. I think this is maybe the 4th or 5th time now over many years. So welcome back. Thank you for joining us today.
Well, thank you so much for having me. This is deja vu, these outbreaks that they're reporting in Texas and a few other states of measles. They're also at the same time reporting pertussis outbreaks. And of course, the main message is that parents aren't vaccinating their children, that we've had this drop in national vaccination rates for school children dropping from 95 to 93%, and that it's all the parents' fault that these diseases are being reported in greater numbers. At the end of, we have to remember that we have a population of about 327 million people. And in 2024, there were 285 measles cases reported in 33 states and no deaths. More than half of those cases were in individuals over 5 years old. 40% of the cases were hospitalized. 89% of those cases were in individuals where they did not know the vaccination status or they were unvaccinated. Now, they don't break down the numbers of how many they didn't know. You know, they didn't know the vaccination status of, and this is quite frequent when they report statistics. So you can't really get a handle on how many truly unvaccinated children there were. But you know, for decades, since the early 80s, the vaccination rate among school children has been fluctuated between 93 and 98%. So that's a lot of vaccination going on. Why are we still seeing measles cases and pertussis cases, et cetera? I mean, if we go back to the 1960s, before measles vaccine was developed, I grew up in the 50s. I had measles, mumps, rubella, chickenpox. All my friends did too. And frankly, if you didn't have complications, which were quite rare for those diseases, the complications being pneumonia, ear infections, bronchitis, brain inflammation, but they happen very rarely. The symptoms went away in about a week. And so you then had a natural, more robust, longer lasting immunity because you had recovered from the infection. And I'm just going to give one stat. In 1955, about 3.5 million Americans out of 165 million were reported to have been infected with measles. 345 died, which means the death rate in 1955 was 1 in 10,000 infections. Measles has never been a leading cause of death in this country, and indeed in developed countries. In underdeveloped countries, it's a different story. But in this country, measles was never a leading cause of death. And I think people just don't understand that because the narrative now is that 1 to 3 in 1,000 die of measles. That is absolutely not true for this country. And before the measles vaccine, mothers who had naturally recovered from measles were able to transfer to their developing babies in the womb maternal antibodies, natural maternal antibodies that protected that baby until the baby was usually for 12 to 18 months. So measles was occurring mostly in children who were several years old to 10 years old. Most children by age 10 before the vaccine had gotten measles. This is a very important point because now that because of these laws mandating the measles vaccine, in the form of MMR vaccine, measles, mumps, and rubella vaccine, live virus attenuated vaccine, the mothers today have been vaccinated and they cannot transfer the natural maternal antibodies to their babies to protect them. So these infants are susceptible to measles from birth. And the other thing that I found really interesting in my research, because I do a lot of research in the medical literature. If you go to mvic.org, you see that our information is anchored with a lot of references from the medical literature, from the government websites. We do our homework before we publish something. And when I was researching measles, I found it very interesting that they knew by the 1970s that there were subclinical infections, there were asymptomatic measles infections, even among the vaccinated. In the 80s, they absolutely knew that there were not only measles failures, but there were these subclinical infections that were either you had few symptoms, like maybe a little rash, a little fever, but not full-blown measles, right? But in 2000, nevertheless, in 2000, the CDC said measles has been eradicated from this country. The only cases of measles are imported. And they're sticking by that story. However, if you look in the medical literature, you can see that in highly vaccinated populations, including the US and in Europe, there is measles circulating among vaccinated populations because there is this asymptomatic mild type measles that they're not reporting. Therefore, the state, if your child has a rash and maybe a little fever, are you going to immediately suspect measles? Are you going to take that baby to the doctor and have the baby tested for measles? No. They don't know how many subclinical infections are occurring. They don't know how many vaccinated people are transmitting measles. And it's the same case for pertussis too. So this is the information that's not really generally known. Mm-hmm. And we don't understand. We don't have a handle really on the diseases that are circulating in our country. Blaming it, just saying, oh, it's all the fault of the unvaccinated. That's the reason we have these outbreaks. That's not true.
Yeah. Well, I wanted to remind the listeners, if they didn't listen last week, I quoted this stat from in 1900 in the United States, 13.3 measles deaths per 100,000 population. By 1955, it was down to 0.03 deaths per 100,000. That's the 98% drop. The vaccines were not introduced by then. They came a few years later. That's the assumption number one I had in medical school, that the vaccines were responsible for this huge drop in infant mortality, almost complete drop. I mean, 98%, 99%. And it's not just measles. You can look across the board. And this was looked at by a number of institutions, including McKinley and McKinley, husband-wife epidemiology team at Boston University, 1977. They published on this. They studied what causes huge decline in infant mortality in the first part of the 20th century. And then Geyer, in the year 2000, he published a study, and that's in the Journal of the American Academy of Pediatrics Journal. And then we had the Harvard Medical School Dean, Edward Cass, who is the founding member of the Infectious Disease Society of America, first president of that society. He looked at this data. They all concluded the same thing, and it's this. Vaccination was not responsible for this dramatic drop because there weren't vaccinations. It was sanitation, clean water, sewage, refrigeration, nutrition. It is clear to all the researchers who go back and look. However, that's not the headline. What the headline should have been, in my opinion, this past couple weeks here in Lubbock was 99% drop in measles mortality. What caused that? And then explain this truth, how nutrition and sanitation and vitamin C from fresh fruits and vegetables is what allowed the immune system to be strong and get through measles so easily. And like Barbara said, when I interview my patients pre-1960, they all had measles, just like I had chickenpox and everybody in my generation had chickenpox. So there's just this context that we're completely missing, and it goes straight to the fear mongering. So I just want to point out that data, 13.3 down to 0.03, basically over a 50-year span here in America before vaccines were even introduced.
Right. And quoting medical literature, I just pulled a couple of studies. I'm very focused on this asymptomatic transmission because it's important to understand that not all cases of measles or pertussis are catastrophic cases that you're going to die or you're going to be brain injured from. Most cases of disease do not have a high rate of complications. Most of these diseases that were circulating were mild for most people, not catastrophic. But here we are in 1989, subclinical measles infection in vaccinated seropositive individuals in Arctic Greenland. You go to 2020, waning immunity and reemergence of measles and mumps in the vaccine era. 2024, long-term waning of vaccine-induced immunity to measles in England, a mathematical modeling study. It has been clear that they've understood this, but they have not told the people. All the messaging is, oh, we've got a couple percentage drop in vaccination uptake. Now, one of the reasons I think that they're really making a big deal about Texas is because, you know that we have been working in the states for several decades, but particularly since 2010 in the state legislatures to protect vaccine exemptions, to add vaccine exemptions, so that people can have true involuntary informed consent to vaccination and not be forced to do something they don't want to do and be punished because they're not obeying the law, that they have to have, all these dozens of doses of vaccines before they enter school or daycare. Well, I took a look at our MVIC advocacy portal for Texas, that our advocacy portal at mvicadvocacy.org. We follow the vaccine-related bills in this country in every state that are either going to expand your right to make a voluntary choice about vaccination or restrict it. And what we found in the last 4 years again, we started really, really drilling down in 2010. We found we are supporting more vaccine-related bills in the states than we are opposing. That was completely not the case when we started intensifying our efforts 15 years ago. Okay, so in Texas, right now, there are over 25 bills that are vaccine related that are being proposed in this legislative session. And there are only a couple that we're opposing because the legislature has listened to the people who do not want to be bullied by doctors and punished for not using 72 doses of 17 vaccines that the federal government now say all children should get. I mean, that's when I started this work in the early 80s, it was 23 doses of 7 vaccines that the CDC was recommending. It's now 72 doses of 17 vaccines. I mean, how many vaccines can the child between the ages of birth and age 18? How much vaccination can the body handle? This is what a lot of parents are asking. Okay, let's go back to these bills. Why are they upset? I think they're very upset about these bills. And that's why they're going to beat the drum about measles in Texas. We have a bill that prohibits a person from compelling, coercing an individual to obtain health care, including vaccines. It adds religious and expands medical exemptions for healthcare workers. We have another bill that removes the authority of health department to add additional vaccines to the childhood vaccine mandate schedule so that only the commissioner can actually recommend it. A bill that requires doctors to report serious adverse events to VAERS for the EUA vaccines. That is vaccines like the COVID vaccine that was approved under an emergency use authorization, not fully licensed. Another bill prohibits the United Nations and the World Health Organization from enforcing international law or policy in the state of Texas. This is one that I really think they're upset about. It repeals the authority to exclude students with a conscientious or religious exemption from attending public school in a declared epidemic. And this one places a constitutional amendment on the November 2025 ballot establishing a right to refuse medical treatment, including vaccination, and prohibits interference with that right. That constitutional amendment that would be coming up in November 2025 is big. And I would encourage everyone to go to the MVIC advocacy portal at mvicadvocacy.org. It's free. If you sign up for it, become a user of it, you can monitor what bills are moving and being proposed and moving in Texas. And you can get involved because you can contact your own elected representatives on that portal with a click. And you can let them know whether you want them to support legislation. You can attend hearings that come up. You know, we all have to get active in protecting our right to informed consent to medical interventions like vaccination that carry a risk of injury or death. And I do think that they're going to try to promote outbreaks of disease in Texas because they don't like this legislation.
Yeah. Well, I want to go back and reiterate your point on these outbreaks there can be subclinical outbreaks, but also I was finding a few different studies. In 1988, 69% of all school-age children in the U.S. who contracted measles were vaccinated. In 1989, 89% of all school-age measles victims in the U.S. had been vaccinated. 1995, 56% of all measles cases in the U.S. occurred in people previously vaccinated. I'm not going to go on and on with the others, but the point being, again, going back to some assumptions, I assumed vaccines were the cause for the 99% drop in mortality, so that's not true. And then I assumed that they work, efficacy and safety had both been studied. So from an efficacy standpoint, if 50 to 80% of certain outbreaks in the last few decades have been in vaccinated kids, there's a question on efficacy. And then the waning immunity that you're referring to speaks to efficacy versus the original natural immunity. All our great grandparents and grandparents and some parents have had pre-1960 lifelong immunity that you pass to your baby, as Barbara talked about. That was the perfect system. That was amazing.
That was a
And
natural system. That was it.
exactly.
That was the harmonious balance, natural balance that we had with nature.
Yep.
This pathological fear of microbes. Every single day we wake up and we see fear mongering about microbes, about this disease or that outbreak. We can't get away from it. And I think, certainly we've learned a lot. The whole issue of vaccine risks and failures has been so elevated since the overreach with this COVID biological product. It's not a vaccine.
Yep.
It's a biological product that has been labeled a vaccine. It's a cell disruptor biological. It hijacks your immune system. It basically causes your cells to constantly try to produce this synthetic spike protein. It's really genetic engineering gone way extreme. And they want to use this mRNA platform for all the existing vaccines, as well as the new vaccines coming. So, I mean, that's something that is another topic. But,
Yep.
what we're doing is we're totally disrupting immune function. I mean, vaccines cause inflammation in the body. They have to cause inflammation in order to produce antibodies.
Yep.
And this constant atypical manipulation of the immune system from the day of birth, the first immunological experience that a child has now, a baby, at 12 hours of age, is a hepatitis B vaccine, when we never had a problem with hepatitis B in this country. When in the early 90s, when they put that policy in place and all the states saluted the federal government smartly and put a law in place for children to attend daycare and school, we had a very low incidence of hepatitis B in this country. And I remember going to a meeting at the CDC in 1985. And I was there reporting a pertussis vaccine death with a mother whose child had died after DPT vaccination. And there was this Merck rep who was talking about how they just could not get the high-risk groups, persons with multiple sexual partners, IV drug users were the number one. And they couldn't get the high-risk groups to take this hepatitis B vaccine. And they told the CDC officials, you're just going to have to pass laws to shoot it into the arms of every high school kid in the country, because we're not going to have an orphan drug on our hands. Well, what did they do 6 years later? They decided that every newborn at 12 hours of age before they leave the newborn nursery is to get a hepatitis B vaccine. When the only exposure really is from a mother who is hepatitis B positive. And back then it was like less than 0.5% of women were hepatitis B positive.
And you can screen for that.
Absolutely. So, the history is important. And I think that because of what they did with COVID, the overreach and all the reactions that have occurred, and the fact that it's a failure, it did not prevent infection and transmission, has really raised the consciousness of Americans. They're more open to talking about this now. And certainly we can see with the confirmation of RFK Jr. to be a secretary of HHS, there is going to be a lot more conversation about what does the science really show. Has the good science been done? I've been saying for years it has not been done. And as you pointed out earlier, all of this chronic disease and disability. I mean, 1 in 6 children in this country are learning disabled or autistic and otherwise developmentally delayed. That is a horrendous statistic.
Yeah. And that text I read earlier about this little baby girl, 3 years old, going nonverbal after her 3-year-old shots. People still, and I'll say health officials, even physicians interviewed in corporate media, will say, oh, that's been debunked, that MMR or vaccines in general cause autism or any of this stuff. Andrew Wakefield's been debunked. He was a fraud. That was actual statement in a local news outlet recently about Dr. Wakefield, which, guys, y'all can go back on the podcast page and listen to my interview with him from a few years ago. But I want to quote real quick regarding injuries in autism and can it be caused by vaccines? Well, we've paid out, we, the taxpayers, actually billions of dollars through the vaccine injury compensation program. And Barbara can speak to this more. But here's a quote real quick from Dr. Richard Kelly, professor of pediatrics, Johns Hopkins University, the Kennedy Krieger Institute. And mind you, Dr. Kelly, a pediatrician at Hopkins, is usually called to the witness stand at this vaccine injury compensation court as to testify basically on behalf of the vaccine companies and the government to say, no, that did not cause this kid's injury, case dismissed. You don't get compensated. Well, in this particular case, here's the quote from Dr. Kelly. I also find with a high degree of medical certainty that the set of immunizations administered to Yates at age 11 months while he was ill was the immediate cause of his autistic regression because of the effect of these immunizations to further impair the ability of his weakened mitochondria to supply adequate amounts of energy for the brain, the highest energy consuming tissue in the body. Translation, Dr. Kelly's saying these shots tipped things over for the sick boy and led to the autism. So it was multifactorial is what he's saying. The kid was sick. So right there, right out of the gate, we should say, perhaps sick children shouldn't be immunized. We should delay that. What you heard last week with Brian Hooker was the Atlanta study, African American boys. There's something about that genotype that if they stick to schedule, CDC schedule, 260% increased risk of autism. So there's another screening opportunity. If you're African American, if you're a male, maybe we delay, maybe we space out, maybe we do something. So this notion that we just come right out and say, oh, vaccines don't cause autism, and no, vaccines couldn't do any of that, and just this blanket statement, I mean, it's just factually on its face, it's not true, and it's delaying any progress in this area. And also it's part of what's diminishing the trust, the faith that we have in doctors in general, which I already mentioned is plummeted from 70 to 40%. So if we can't even admit to past misunderstandings, wrongdoings, or just lack of knowledge, whatever you want to call it, we were wrong. We can't admit to being wrong, and we sure can't apologize. Then how are we going to advance this conversation? Oh, well, the general public and the moms and dads, they're making their decision, and it's clear.
Well, they are. They are. And, it's very frustrating for me to hear that story because, my son, who had a reaction to his fourth DPT shot, a convulsion, collapse shock, and a brain inflammation within hours of that shot, should never have been vaccinated that day. And we're talking 1980. He had a viral infection 3 weeks earlier. And back then they gave antibiotics for everything. And he was given a round of antibiotics. He was just coming off a round of antibiotics. He still had traces of diarrhea. Now, whether that was because he still had a coinciding viral infection or not, I don't know. But all I know is that he was not entirely well that day. And he had a reaction on his third DPT shot, a very severe local reaction. So there were two things against him, right? And, he had a severe reaction. One of the first things we called for back in the 80s when we were working with Congress on the National Childhood Vaccine Injury Act was that there should be proper screening of children and that sick children shouldn't be vaccinated. Well, what did the CDC do and the American Academy of Pediatrics over the years? They narrowed the medical exemption. So almost no healthcare condition, even a previous seizure reaction, previous clear-cut reactions are considered a medical contraindication. It's no wonder all these children are having reactions. There's no screening whatsoever. And what is that? It's because the public health, the mass vaccination program is based on the utilitarian rationale that some can be sacrificed for the rest. And that's why I've been such a proponent of informed consent, because that greater good argument is a pseudo-ethic. And it was judged to be a pseudo-ethic at the doctors' trial at Nuremberg. When those doctors were tried for crimes against humanity, when they were testing these vaccines and these drugs and all these things on captive populations during the Holocaust. And that Nuremberg Code was applied to scientific experimentation on humans. but it was eventually expanded to include clinical practice. You know, the first do no harm ethic, not that you take public policy and you consider some people expendable for the rest. My son was not expendable in my view. And all these children, now we have, I'll quote you from an Institute of Medicine report in 2013. An Institute of Medicine report on the childhood vaccine schedule from birth to age 6, where we had insisted that they address the issue of whether or not that schedule had been properly studied. There were less than 40 studies in the medical literature that addressed the early childhood schedule recommended by the CDC. And what did that committee find? They concluded there was not enough scientific evidence to determine if the recommended child vaccine schedule is or is not associated with the development of the following brain and immune system disorders prevalent among children today: asthma, atopy, allergy, autoimmunity, autism, learning disorders, communication disorders, developmental disorders, intellectual disability, attention deficit disorder, disruptive behavior disorder, tics and Tourette syndrome, seizures, febrile seizures, and epilepsy. That's 2013 that a scientific body concluded that schedule had not been studied. And here we are in 2025, and these children are still getting that schedule, and it hasn't been scientifically proven to be safe, particularly in combination where a child today can go into a doctor's office and get 10 vaccines, 10, 12 vaccines. There is no screening, there is no logic to the idea that a child, an infant, can tolerate an unlimited number of vaccines. You know, that's really they believe that you can give as many vaccines. I remember Dr. Paul Offit about 20 years ago said a child could tolerate up to 10,000 vaccines.
Mm.
And so
Unbelievable.
I really hope, I know there's been a lot of opposition to the appointment of RFK Jr., but there's one thing I do know. I do believe he is going to get the science done. I do believe he's going to make that a high priority.
Yeah.
And that is absolutely has to be the first priority in terms of these vaccine policies and laws. And the second thing is we shouldn't have mandatory vaccination laws.
Yeah.
What we should have, these products should be subject to the pressure of the marketplace, the law of supply and demand. The vaccines that people believe are safe and effective, that they have been shown with proper science are safe and effective, and that they believe are right for their children or themselves, they have free license to use as many vaccines as they want to. But no one should be forced. And that's the difference. There also should be liability on the part of the company that produces the vaccines. There should be full liability.
And speak to that, because there's not liability. Talk about that for folks who don't know about that.
Yeah, I'd like, you know, there's been a lot of myth that's grown up around the National Childhood Vaccine Injury Act that I worked with Congress on, as did a number of other parents of DPT vaccinated children. When that law was passed in 1986, there were two parts to it. The vaccine safety provisions, which our organization got into that law, informing, recording, reporting safety provisions, including VAERS. Then there was a compensation mechanism. That is that people that didn't want to go to court, which is a very expensive, long, drawn-out process with these big companies that have deep pockets. Most of those lawsuits back in the 80s were settled on the courthouse steps for very low amounts because the parents didn't have any money. So people don't realize what the situation was back then. But when we got that law passed in 86, the doctors were still liable for medical malpractice. The companies were still liable for product design defect, failure to make a vaccine safer. So companies and the doctors, the administrators, were still liable. They got partial liability protection. What did they get it for, the companies? Failure to warn. Who assumed that? The CDC. with the parent information statements. The CDC's parent information statements were supposed to replace what the companies were giving the information, although there's still product inserts for the companies. They still have to do that through the FDA. But still, there was still liability. Now, what happened within a year of that law being passed? The AMA and the AAP lobbied secretly behind our back, and they got an amendment to an omnibus budget bill in 1989, at the end of 1987, within 1 year of the law passing, and they got medical malpractice removed. So now the doctors are not liable as of 1987. They can do whatever they want to. They're not liable for medical malpractice when a kid gets injured by a vaccine. Then fast forward to the 90s, where Congress, the same people that supported the law and worked to have it passed, gutted the vaccine safety and compensation provisions. By 2011, there was a case, a DPT vaccine case, Brucewitz versus Wyeth, and the government and the manufacturers and all the public health organizations and all lined up with Wyeth. NVIC and some other patient groups lined up with the plaintiff, and the Supreme Court said vaccines are unavoidably unsafe and there should be no liability for the manufacturers. And they took away product design defect, which left this country with mandatory vaccination, and nobody is accountable for when vaccines injure or kill. Not the people who give it, not the people who license it, who mandate it, who produce it and market it. Nobody. Who is left when you get hurt by a vaccine? You are left. You and your family are left to deal with that. So I don't think there should be mandates. I think there should be liability for anybody involved in the process, and definitely informed consent.
Yes, 100% agree, Barbara. Wasn't also part of that process in that law, the CDC was supposed to do a study.
Yes.
Vaccinated kids versus unvaccinated kids. Let's follow these kids for a while and determine which group is healthier. Weren't they supposed to do that?
Well, there was specific language in that law about research, about the types of research, including the fact that there was supposed to be oversight through the National Vaccine Program, which they've completely gutted, to do these types of studies. It was supposed to be an oversight mechanism on HHS. Well, you know, both sides of the aisle in Congress get money from pharma, right? What happened was Congress passed it and walked away. And so the research that was detailed in there, it didn't say specifically vax, unvaxxed, but it talked about the different types of studies that need to be done and what needed to be looked at, including high-risk groups. It was not done. The best that you can come closest to is these reports that the Institute of Medicine put out over a span of 20 years between 1991 and 2013. And they looked at the medical literature and evidence, but they didn't really do the types of studies that were supposed to be done, which would be your biological mechanism studies, your epi studies, where you either do case control, retrospective or prospective. Prospective is the best. They didn't do that.
But we have since, other folks have done that. I think the other day I was trying to find, there's been 5 or 6 maybe now, studies looking at vaccinated children versus unvaccinated children in terms of just overall health. Otitis media, autism, neurodevelopmental delay, ADD, ADHD, chronic disease, ulcerative colitis, autoimmune diseases, stuff like that, consistently from what I've seen. And it's quite remarkable the difference. The unvaccinated children are by far healthier. Is that what you've seen in the literature?
Oh, yes. The problem is, like, NVIC funded the latest study that has come out, the Mawson study that Kennedy actually referred to in his confirmation hearings, which caused a lot of, everybody was upset because he said, well, it wasn't published in a journal that is indexed by Medline. So that study, though, looked at the Florida Medicaid database, and it was a retrospective cohort study, and it looked at 9-year-old children that had been followed for a number of years, vaccinated and unvaccinated. Okay. There was obviously far fewer unvaccinated, especially in a Medicaid population. However, there was enough that the office were able to do an analysis and did find an association between particularly the increasing numbers of vaccination and neurodevelopmental delays. Not just neurodevelopmental delays, but learning disabilities, which is what my son had, multiple learning disabilities, ADD, ADHD. And this showed an association for learning disabilities, ADHD, autism, spectrum disorder, preterm birth. I mean, these little preterm babies are often given these vaccines according to, not according to their actual developmental stage. You know, they say they're born 8 weeks early, they still are vaccinating them, never, regardless of the fact that they're preterm. And so there's definitely an association there as well. Now, I would encourage people to take a look at those studies, because we also cooperated in 2005 with University of Illinois researchers on asthma and hay fever. There was a positive finding there with vaccination and the development of asthma and hay fever.
Yeah. So guys, this isn't a matter of, hey, why don't you just take these vaccines, because what do you have to lose? Are going to help, give you some kind of immunity to these germs. Well, always risk versus benefit. And when you look at these long-term outcomes, and as Bobby Kennedy has definitely put the spotlight on all these statistics, our kids are the sickest kids in the world. And a lot of these escalations have been over the last 10, 20, 30 years. I mean, autism's, I think the first case was in 1934, but the rate was fairly steady for decades. In early 1970s, when I was born, 1 in 10,000-ish roughly, and now we're at 1 in 36 and escalating. So I quoted from this earlier when I was Dr. Kelly's quote, but this book by J.B. Hanley, How to End the Autism Epidemic, and I interviewed J.B. You can go back on the website and find that interview. That book lays out the case for, here is how an injection of aluminum into your arm or your thigh or buttocks as an infant, how that aluminum can be captured by an immune cell and translocated up into the brain and deposited and initiate this neuroinflammatory response. I mean, the science, the research of mechanism of action for how this pathological neurodevelopment event could happen, it's in the book. I mean, the published literature is there. So there's just at this point, overwhelming amount of evidence. Chris Exley, Exley, he's the world's authority on aluminum. And I interviewed him. You can go back and find that. And in his opinion, the aluminum, and this is more with in elderly folks, Alzheimer's, he didn't think it was possible for a human being to get Alzheimer's without aluminum, which aluminum's in these injections, including the hepatitis injection, Day of Life 1, Barbara alluded to, 12 hours old. Let's inject aluminum. It's a neurotoxin, 250 micrograms. And it's not even, well, Chris Exley would tell you zeros where it needs to be, but 25 micrograms is supposedly the safe upper limit of normal, 250 micrograms. And blood-brain barrier is not developed till day 8 of life. I mean, there's just so much we could go on and on and on. Barbara, we've got maybe 10, 15 more minutes or so, or 10 more minutes actually. MMR in particular. I mentioned Andy Wakefield earlier, Brian Hooker. But can you speak to the potential side effects or the potential damage and any evidence that either published, unpublished, or statistical manipulation of data in regards to MMR safety? We know efficacy, there's waning immunity. I treated an adult today who had been vaccinated multiple times with both MMR separated, and because he was born in Mexico, and then when he immigrated here, the immigration official says, that doesn't count. You're MMR separated. You got to do MMR together. And so then he got that series, and he's in my office with measles. So there's
and there you go. I mean, that's the dirty little secret, actually, is how much measles is circulating. And so that these statistics are not really accurate when they say we just don't know. The issue is we don't know. But measles, MMR vaccine, if you go in the literature, it's clear that MMR vaccine can cause brain inflammation and encephalopathy, which was really the centerpiece of the compensation program under the 1986 Act, because many vaccines can cause brain inflammation and encephalopathy. Of course, pertussis vaccine, whole cell pertussis, was one of the most notorious. But MMR vaccine has been associated with seizures and with brain inflammation, encephalopathy, which chronic brain dysfunction, as well as a blood disorder, thrombocytopenia purpura, which is that can be fatal. And also vaccine strain measles infection, which can be very serious. But I think a lot of people, especially in the last 25 years, somehow have associated vaccine injury only with autism. Mm-hmm. And that's really not accurate. When you have a brain inflammation, you can have a spectrum of brain dysfunction that spans from the milder forms of attention deficit and learning disabilities, like my son suffered, all the way through to autism, to mental retardation. There's all kinds of immune system dysfunction that also can go along with a vaccine reaction, including MMR. And it's really an interaction between the vaccine and the host. And we're all different. We're all born with different medical histories, family and personal medical histories, different microbiomes. We live in different environments. But the vaccine policy is a one-size-fits-all approach. It does not personalize the vaccination intervention. And this is probably the biggest thing. My son, they didn't factor in that my son was not entirely well that day, that he'd been coming off of antibiotics, that there's a bioactive pertussis toxin and endotoxin in whole cell pertussis vaccine. If he's been on antibiotics, he's already got an endotoxin. His body is already excreting endotoxin. Mm-hmm. And you give a vaccine that has bioactive endotoxin and bioactive pertussis toxin and aluminum and mercury. It was a perfect storm. Plus, he had a reaction prior. There was no personalization of that process that day. And this is the thing that is probably the worst part of mandatory vaccination. The enforcement of mandatory vaccination is the individual is not considered. And it's why there is a loss of trust in the public health system, because it takes a collectivist approach. It takes a population-based approach. It forgets the individual. And when a mother takes her child into a doctor, she is not thinking about the population. She is responsible for her child, to keep her child well. And if every mother can work with a doctor and keep their child well, the population will be improved. It shouldn't be it's like upside down. You have to start with the individual.
Absolutely.
And, yeah. And the doctor-patient relationship has just been all but destroyed. I have a lot of friends, they just don't even want to go to a doctor. They're afraid to go to the doctor.
I hear it every day, every single day. It's the number one reason new patients come to our clinic now, including a patient just recently drove 12 hours from Missouri, I think it was. And I asked him why. He said, I don't trust any doctor in my town. That's a sad, sad commentary, but that's daily. I hear it all the time. And then these pediatricians I mentioned,
they've been acting like policemen.
Yeah.
Like during the COVID pandemic, people were so afraid to go to hospitals because they knew that those ventilators, if you went in there and you had COPD or a coinciding, they put you on a ventilator and you never got out of the hospital except for in a coffin, because there was no individualization of the policy.
Yeah. Individualized medicine. That's what we like to practice here, for sure. That's what's the most beneficial thing for the patient. And that's what we're all about. The patient sitting right in front of me. What's best for that person. Guys, nvic.org is Barbara's organization. Again, back to the 80s. She's been working on this topic for a long time. She's a passionate mama and grandma, I'm assuming, Barbara. She loves the people. I love the people. And I'm not saying these regular, conventional standard corporate doctors don't, but they're in a system. They've been brainwashed under the three assumptions, like I mentioned at the top of the show. They walked out of med school assuming vaccines were responsible for the 99% drop when they weren't. They're assuming vaccinated children are healthier than unvaxxed, which multiple studies say that's not true. And they were assuming that the CDC has studied this childhood vaccine schedule, as Barbara said, 72 different doses of 17 vaccines, and they haven't. Those are three very big assumptions. So if we just informed, if the local health officials and doctors would inform themselves, inform the public, we could all come together and just have a conversation. So we could individualize it, because really what we've traded is a week of fever and rash and cough and red eyes. And guys, I know it's hard to be sick. It's hard to have the flu. It's hard to have RSV. But you can overcome it with a healthy immune system, a healthy body. But we've traded that for eczema and asthma and ADD, ADHD, and all the stats that Bobby Kennedy, that pediatrician actually that called me from the Austin area, told me that basically every kid in her practice now has eczema. It's just, and that's an autoimmune, guys. Our immune system is so upside down, so dysfunctional and attacking ourselves now. It's just unbelievable. But we've got to wrap it up here. Barbara, I'll give you the last word. Any closing thoughts or comments?
Well, I've really enjoyed the conversation. I wish, do I ever wish every town had a doctor like you? It can be done. People have to open their minds up. We have to not accept all the myths and the propaganda that certainly has really propped up this mandatory vaccination system. So I believe in doing the research, keeping your mind open, both the doctors and the patients. So, and then coming together and valuing that individual child that's presented that day for whatever reason, whether it's a healthy child or a sick child, doing the best for that child rather than saying that somehow the community is more important than that child. It's not true. Every child's life is valuable and every child's life should be protected. So, I'm hoping we will have a new day of looking at vaccination and health in a different way. And I thank you for doing this program, because there's not enough programs like this.
Well, you're very welcome, Barbara, and I wish there were a whole lot more of yous out there too. You've done amazing work for all these many decades. Thank you so much. I know a lot of my patients and general public that call or email or listen to the show go to your website, because I point them there to get that information. So without websites like yours and all your hard work, we wouldn't have this informed consent that we're able to do for our patients. So thank you very much. Okay, everybody, Dr. Ben Edwards, You're the Cure. Remember, this will be archived on our website, veritaswellnessmember.com, and just click on resources, then podcast. Give it a minute to load, because there's a whole lot of shows, years and years worth of shows. But there's a whole vaccine section under topics. Click that, go down, vaccines. You'll see Barbara's on there 3 or 4 times already. We'll add this one to it. And then, like I mentioned, a lot of these other folks, Tom Cowan, JB Hanley, Neil Miller, Brian Hooker, and others are on there. So go check that page out and get informed. Until next week, we'll see you next time. Bye-bye.